find so many complaints of TB. You find so many inmates, contracting TB from our prisons. So TB elimination is one of the main issues that we discussed in Dar es Salaam.
Yeah. Can I come in?
Definitely, yeah. But before you just come in, Honorable, I would like to ask Honorable Chibombwe, from what you've mentioned, from the experiences and what goes on, is this reflecting on the ground once you come back, like after the conference, you came back to Zambia, did that reflect even through you as the Committee on Health?
Yes, it does reflect, because from there, from the commitments made, one of the issues actually that have been coming up on all these conferences, I think from the 15th, the 16th, and now we'll be talking about the 17th NEAPACOH meeting, is the domestic resource mobilization. Zambia made commitments. We came here, we presented a report on the floor of the House, and to that effect, we've seen that the 2026 budget, Zambia managed to, put at least about 86% of the national budget from just, the local resources. Yeah. So the results are there. We're seeing them, and we talked about sin taxes when we were in Tanzania, and sin taxes have been introduced here in Zambia, and part of that money will go towards health financing. So we're seeing these things on the ground. They are real.
Okay, Dr. Kalila, I would like to get your comment on what Honorable Chibombwe has said, and would also like to know, you as chairperson of the Commonwealth for Parliamentary Association, you're representing, you are the chairperson. Is there anything that the CPA is doing to work hand in hand or help NEAPACOH progress with whatever discussions are discussed during the forum?
Yeah. Okay, so thank you very much, Daza, for that. First of all, you asked a question, but basically trying to understand what goes on at NEAPACOH meetings, what happens. So remember, this is a conference, usually 3 days, as in many conferences, international conferences. So on the first day, the morning, usually the first half of the morning is dedicated to the official opening, where there are speeches from high-ranking officials. And that definitely will happen here too. Why do we do that? First, it's to set the tone of the meeting. There must be a keynote address. In this particular case, I'm informed probably from the speaker, and also maybe from the Ministry of Health and various other high-ranking officials from NEAPACOH. And by the way, it's not only parliamentarians who will attend this conference. We also extend the invitations to other international development partners who come, those who are actually operating in the health space, who support health. And so it's an international conference. It's quite important to us and obviously to the nation. I hope it will be viewed as such. So we expect more people beyond the parliamentarians and their clerking staff. So first part, official opening, speeches from our National Assembly. And I must say thank you very much to Parliament Management, obviously, for facilitating this conference, all of you that are working tirelessly to promote this conference, to the Honorable Madam Speaker for actually having accepted and agreed that we host this Parliament in the National Assembly, to basically all our hard-working staff here who will be involved with this. We are very grateful, because if they wanted, they could have turned it down, but they agreed and said, we need this. Okay, because that's the way you put your country on the map, that's the way you elevate your parliament, that's the way you become relevant in South-South cooperation and parliamentary diplomacy, as I have said earlier. So after the opening session, there's a group photo. People must go out and come together, take a photo, so they can keep memory of what happened and where they went. Thereafter, usually, countries go into reports. So we'll have all these countries basically reporting on what has been happening in their committee, in country where they're coming from, and also to probably give an indication from the last meeting, what has happened and what has not happened, the commitments that are agreed to do. And then maybe on the next day, you have sessions on presentations on various health priorities, as Vivian was talking about. Okay, domestic health financing, tuberculosis, epidemic preparedness, or it could be universal health coverage, maternal mortality, adolescent health, it could be antimicrobial resistance. I have not looked at the agenda actually to try and know exactly what are the topics for discussions this way, not because I didn't want to, but because I was away. I just came back, but I would like to believe there's already an elaborate agenda of the various discussion topics that will happen. And that will be on the second day. And then on the last day, the resolutions and an outcome statement is delivered, which will be called the call to action and the Lusaka
call to action.
Lusaka declaration.
Kalila, let me cut you there. And I would like to know the role of CPA, especially to supporting the NEAPACOH member countries. What is the role, especially in developing and implementing effective health policies?
Yeah, so the Commonwealth Parliamentary Association is a family of member states who are mostly former British colonies coming together. So we operate mainly by strengthening parliamentary democracy and also strengthening our parliaments generally. And in so doing, we look at various aspects of parliamentary practice, including committee systems, you know, the role of presiding officers, the good governance, the rule of law, respect for human rights. So mainly, it is mainly on the political front, okay? However, since I took over, I have since introduced a health strand. That is very important that our Commonwealth begin also, apart from the traditional political issues, good governance, rule of law, parliamentary strengthening, we should also begin to look at health because it starts and ends with health. We can't be here if we are not really feeling well. Yeah. So on that basis, I'm happy to mention that last meeting, which was in Tanzania, I was invited as CPA chair and I delivered a speech and I was asked to basically chair various sessions and to give the vision on the CPA. So we have begun to collaborate with parliamentary bodies, either like NEAPACOH, like the East African Legislative Assembly, like the Pan-African Parliament. We want to collaborate with these. But please bear in mind that NEAPACOH goes beyond the Commonwealth. We have member states in NEAPACOH who are not CPA, particularly our colleagues from the French-speaking countries and so on. But the bulk of them, we know they are CPA, and so we would like to obviously move together, particularly here on the African continent, where there is a double burden of disease, and the health indicators are ranked among the worst in the world. It is very important that at CPA level, we must lend a hand, we must collaborate, we must revise, work together with our parliaments. It's part of parliamentary strengthening.
Let me just bring in Honorable Chibongwe. We are running out of time, but what key issues do you anticipate to be discussed during this year's forum, and it being the 17th forum?
Yeah. Of course, what I expect is that among the issues we should also continue, discussing the subject of domestic resource mobilization, especially in, that the USG is actually, pulling out of, most of our cooperating partners are also lifting the handbrake. They're not really supporting us that much. So we should continue, having conversations around the issue of domestic resource mobilization. Then the other thing that we want to talk about is the issue of antimicrobial resistance. I know Dr. Kalila alluded to that fact. This is what other people are calling as the new pandemic in Africa. Most people are not reacting to the so-called antibiotics. So this is a big issue. It's a pandemic just looming, and I think we should control this before it gets out of hand. I mentioned the Tobacco Control Act. I also mentioned the conversations around our own traditional medicines. I think these are issues that we should start looking at, seriously as a continent, because we've seen that our colleagues in the Far East are using their own medicines and they're actually bringing those medicines into Africa. So why can't we as Africans also start, using our own medicines? We have, for instance, here in the country, the Sondashi formula, which has been undergoing a test for quite a long time. And I think for more than 20 years, it has passed, I think, the first and second clinical trials, awaiting the third clinical trial, but there is no fund to sponsor the third trial. So those are, I think, some of the issues that I'm eager.
Okay, thank you very much. And Dr. Kalila, briefly, what are your key expectations during this forum? And just briefly highlight, if at all there have been any limitations in advancing universal health coverage at a local level and global level.
Yeah, so I've got actually very high expectations at the forthcoming conference, even though I'll not be around, regrettably, because I have to leave to chair a meeting in England for CPA. It's actually very heartbreaking that I'll not be at this very, very important conference. But I'm in touch with the organizers to see if I can try to attend virtually or even make a presentation virtually. But my expectation definitely is that as Africa, it's high time we began to collaborate and work together and to take concrete steps, okay, from policy to action. You see the things that we put on paper and so on, we must now begin to see them being actualized. In this particular case, I am looking forward for a discussion around strengthening our health systems on the African continent, to make them more robust and resilient to withstand the shocks, to be able to deliver the health that they purport to be. So what do I expect? That there will be discussions around infrastructure to ensure short distances for people to reach these health facilities, to ensure that the health facilities are stocked adequately with the various commodities, or what you guys like to call drugs, okay? And to do that, it's high time on the African continent we began to manufacture some of these medicines, as my colleague has alluded to. So there must be a discourse around this. We must manufacture our own medicines, we must manufacture our vaccines, because last time we learned heavy lessons when there was an outbreak of COVID-19, we were in the queue and we were put at the end. And we couldn't do anything else. We don't make this. So the people who make them prioritize their own citizens. So I expect a discourse around local pharmaceutical manufacturing, and of course Zambia is taking the right steps in that direction. I also expect that there will be a discourse around human resources for health, meaning that we need to continuously train a lot of our young people to take up these training in the health sector, doctors, nurses, paramedics, and so on and so forth, and to create sustainable ways of absorbing them, to fill up these positions which we are creating by rolling out infrastructure. I expect that there will be a discussion around how to finance health, and that's critical. I expect a discussion of what are the ways and means through which governments can leverage more money outside traditional budgets. One of the things is to, like the sin taxes is talked about, or do we introduce special levies, for example? Should we introduce health levies for you to contribute to the health sector? What's the role of the private sector? Yeah. How are they putting in money in the health? What is the role of philanthropy? And so on and so forth. I also expect that there will be now a discussion around some of our traditional or health priorities. We must continue the things that we have been doing right. In other words, continue making major strides in combating malaria, HIV. You know, now we are completely concerned and worried that we think that we are letting the foot off the gas pedal. We're seeing more infections in young people. We need to continue to go back, advocate where we were. Prevention, 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 ABC, and so on. We want to deal with non-communicable diseases which are now ravaging our populations and citizens. These are your diseases like diabetes, your diseases like hypertension, cancers. Very big issue.
Okay,
very
Dr.
big subject.
Kalila,
Right
quite
now,
high expectations.
extremely a lot, and I could go on and on. I'm particularly concerned about the sheer numbers of citizens we are referring outside the country to go and seek services outside. We should begin to invest locally in our health system so we can do that. You know, we have so many going out. Look at the amount of money that's being spent. We could do something about that. Maybe I'll end here.
Yes,
we'll find
definitely.
quite,
I can see quite a lot of expectations that
yeah.
you have during the 17th NEAPACOH forum update, and it's quite unfortunate that you won't be attending it. You'll be out with other commitments. But just allow me to say thank you for making an appearance on today's program, and Honorable Chibombwe would like to say thank you for also making an appearance on today's program. To our viewers and listeners out there, thank you for being a part of this program today, and our social media followers. We appreciate your following, and remember, we will continue bringing you these updates up to the time the conference will begin. That's on the 25th of February 2026. From me, Taz Apiri, keep watching Parliament Television.